Hi everyone, welcome to episode 22 of Let's Talk Mental Health. Our topic today is schizophrenia. Schizophrenia is a mental health condition that affects how people think, feel, and behave. It is a mix of hallucinations, delusion, and distorted thinking and behavior. People with schizophrenia lose touch with reality, and that makes it hard for them to live their everyday life. The symptoms of schizophrenia, number one is delusions. Delusions, this is when people believe things that aren't real or true. For example, they may say people hate them, people are talking about them, people are laughing at them, or they are a very important person in society like a celebrity or the president. Then hallucinations. Hallucinations, this is where they hear, they feel, they see, they even taste things that other people do not observe. And this seems to be very real to schizophrenic people. And then hallucinations can happen with all other senses, but it's very paramount with the hearing. They hear things that other people do not hear. For example, some may say you hearing the dog barking, or they seeing the dead mom, or they seeing a devil. These things, they hear and see things that other people do not observe. The third symptom is disorganized speech and thinking. Disorganized speech leads to disorganized thinking. People who have schizophrenia may find it difficult to converse with others who are not schizophrenic, because you ask them something and then they will reply to you something that is completely out of the topic of discussion. The fourth symptom is extremely disorganized or unusual motor behavior. Schizophrenic people or people who live with schizophrenia may not follow instructions, and they may move in a way that is inappropriate to the social setting they are in. The next one is negative symptoms. People with schizophrenia may not be able to function the way they could before the illness started. So that includes the way they think, the way they act, their mood. They may not be able to go back. For symptoms in teenagers, you will see feeling depressed or irritable, lack of motivation, having trouble sleeping, withdrawal from friends and family, and even they may not be able to do well in school. So people with schizophrenia usually are diagnosed in their early teen years to their late 30s. In men, symptoms usually start in their late teen years to their early 20s. In women, symptoms are seen in their late 20s to early 30s. It isn't common for children to be diagnosed with schizophrenia. Remember, we spoke about the symptoms that teenagers present. Those symptoms can also present when teenagers are using recreational drugs. But as compared with adults with schizophrenia, it is less likely for teens to have delusions, and it's more likely for them to hallucinate. So it isn't known what causes schizophrenia, but researchers want to believe that it is a mix of genetics, brain chemicals, and the environment that may play a part. And changes in naturally occurring chemicals, brain chemicals, including neurotransmitters known as dopamine and glutamate, are believed to play a part when it comes to a person developing schizophrenia. Although there is no known cause of schizophrenia, but there are risk factors that makes a person more likely to have schizophrenia. So we have a family history of schizophrenia, living in extreme circumstances like poverty, stress, and danger, also using mind-altering or psychoactive or psychotropic drugs by adults or teenagers. And the last one is some birth issues like not getting enough nutrition before and after birth, low birth weight, exposure to viruses or to toxins before birth that may cause brain development issues. For prevention, there is no sure way to prevent schizophrenia, but if you have schizophrenia, staying with your treatment plan can prevent the symptoms from going and coming, and it can also stop it from getting worse. When to see a doctor. People with schizophrenia often don't know that they have a medical condition that needs medical attention. As a result, it is their friends and family that usually gets them the help that they need. And in doing so, It's not by dragging them to the hospital, but it's by having a conversation with them or even having a mental health practitioner coming in to talk to them. And that's about it for today's video. I hope you learned. Remember, an informed mind leads to a changed behavior. I'm Reverend M. Smallwood, a clinical social worker. Until our next episode, adios.